Hello and welcome to Transforming Healthcare, the people behind the progress, our HSE technology and transformation video series where we highlight the people and programs driving digital change across our health service. Today I'm joined by Derek Tierney, Head of Health Infrastructure and Digital Health at the Department of Health. Derek brings a wealth of experience in public service reform, and he's now helping lead the delivery of the Digital for Care 2030 strategy. We're pleased to have him here with us today to talk about collaboration, long-term planning and the future of digital health in Ireland. Derek, can you start by telling us a bit about your role at the Department of Health and what drew you into the digital health space?
Joyce, thanks for having me here to participate in the series. Before I joined the Department of Health, I was actually Programme Director for the rollout of the COVID-19 vaccination programme, and we all saw the power that digital had in enabling both our response to the pandemic and even the rollout of the vaccination programme, where we used data to derive insights, we rolled out a full vaccination record system, and we engaged through the public through multiple digital channels. When I finished on the vaccination programme, Robert asked me would I join the department to take on the role of health infrastructure, and that widened to build on the experience of using digital through the pandemic and really think about how can we enable the health service and a reform of the health service using digital.
Derek, you've worked across many areas of public service reform. What does transformation mean to you when applied to digital health?
Joyce, that's a great question. So really for me, transformation in digital health refers to a fundamental shift in how we deliver healthcare. When we look at the demand that's ahead of us, when we look at the resources that are going to be constrained in terms of labour and workforce shortage, and ultimately the experience we can bring into that reform. But it really is about moving it from a fragmented, paper-based, siloed system to one that's fully integrated, data-driven and patient-centred at its forefront, all enabled by clinical leadership, service delivery and ultimately technology. This implies change, and change that needs to be properly explained, owned, planned, managed and delivered.
The Digital for Care strategy is a major milestone in Ireland's health journey. In your view, what makes this strategy so significant?
I think if I was looking at Digital for Care, it is significant because what it attempts to do is unify fragmented systems through a shared vision for digital integration. And it is about replacing siloed workflows with connected care models. For example, our shared care record programme, which we've just now mobilised and signed contracts for. It aligns with Sláintecare goals by shifting focus from a hospital-centric to community-based care, and one that's actually enabled by telehealth, remote monitoring, video conferencing and virtual care models. It fundamentally prioritised patient empowerment through tools like the HSE's award-winning Health app, which grants direct access to patients' own personal health data and appointment management.
Derek, how do you see the strategy balancing long-term digital ambition with the immediate needs of patients and clinicians?
It's a great question, Joyce. I mean, even today the strategy is achieving a balance through short-term wins. So we've launched the HSE Health app, we've issued its second release, and that is giving immediate patient access to their own health records and appointment scheduling, particularly maternity patients. We've now mobilised our shared care record programme, and that's all about reducing duplicate tests and improving care coordination by allowing those that provide health care across a patient's journey see the totality of health care. We've also started procurement for e-prescribing, and that's really to replace both traditional handwritten prescriptions and also update or upgrade the use of health mail and to provide a more digital readable format, streamline our process for issuing prescriptions and improving accuracy. And we're also widening the use of telehealth and virtual care models to push that shift of care that Sláintecare looks for out of hospitals towards community and caring for people in their home. We're also rolling out modern office software and clinical applications to support our staff. And lastly, we're now starting to automate repetitive processes and trial AI for safe and responsible use to support how we deliver care. When I look at the longer term, we're now starting to plan for a national EHR system to unify health data across all our regions by 2030. We're developing a digital workforce strategy to upskill our clinicians and our staff to reduce administrative burden and give more time to patients. And we're also starting to introduce hybrid care models, which is really about combining in-person and virtual services together to address current capacity issues, increasing demand while building a future-ready infrastructure.
What are the biggest challenges, do you feel, the strategy is trying to solve for both in terms of services and people's experience of care?
So Digital for Care targets critical challenges that the health service currently faces. When we look at it in terms of services, we do have fragmented systems. We have legacy IT systems, and that actually hinders our ability to share data. It hinders our ability to enable care coordination, and it mandates interoperable platforms. So we really need to enable digital triage, virtual care, to reduce that hospital demand pressure and shift our care to community-based settings to reduce unnecessary admission. For the patients and for the staff experience, we know anecdotally clinicians spend about 30% of their time on administrative tasks, and digital and automation should free up capacity to give direct patient care and reduce that burden. We know vulnerable groups risk exclusion from digital services, and we were very careful in designing the strategy to emphasise an ongoing need or focus on the patient through an inclusive design and hybrid care options. And lastly, the strategy recognises the need for robust governance frameworks to ensure compliance with EU regulations while enabling cross-border health data exchange and to deliver data security and maintain that trust and confidence in the health service. I think in summary the strategy significant lies in its systemic, patient-centred approach to modernising the health service, while its phased implementation ensures tangible real benefits alongside ambitious structural reforms.
Derek, how does Digital for Care support a more inclusive, equitable system, particularly for people in rural areas or those with complex care needs?
Digital for Care really emphasise patient empowerment up front. It's about giving people greater control over their own health information and enable them to start managing their care more proactively. So by focusing on accessibility, connectivity and integrated care, Digital for Care really is about creating a health system that is more responsive to the needs of all citizens, regardless of where they live or even the complexity of their health requirements. So for example, use of telemedicine, video conferencing, remote care monitoring and virtual care models mean patients in remote locations can receive timely consultations, ongoing monitoring and digital therapies from the comfort of their own home even, and ensuring that geography doesn't really limit any access to quality care. When I look at individuals with complex care needs such as chronic illness or multiple health conditions, really what Digital for Care is about is supporting integrated care through shared care records or electronic health records. These are tools that ensure all healthcare providers involved in the patient's journey have up-to-date comprehensive information, and that has to facilitate better coordination and reduces the risk of fragmented or duplicated services and ultimately provides better care for the patient.
Derek, as you can appreciate, trust and transparency are critical. So how is the strategy addressing concerns around privacy, data protection and even digital inclusion?
So Digital for Care as a strategy places trust, transparency, privacy and digital inclusion at the heart of its approach to digital health transformation in Ireland. The strategy is built on secure foundations and digital enablers as a key principle, and that's about ensuring that all digital health services are designed with robust data protection, cybersecurity and privacy safeguards in place and upfront. Trust is fostered through transparency about data use, ongoing education on data security for both the public and our workforce, and ongoing active engagement to address concerns and build confidence in the digital health ecosystem. This is really about an integrated approach to ensure that privacy, protection and inclusion remain central as Ireland's health system evolves.
Derek, a standout theme in Digital for Care is collaboration. Can you share how the Department and the HSE are working together to make this a truly system-wide transformation? And even how important it is that both organisations speak essentially with one voice on digital health?
So I think it was very clear up front that we recognised the public engaged with one health service. So it was really important that both the Department and the HSE were focused on making sure that any Digital for Care strategy was co-designed with patients at the centre, a strategy that could be communicated and understood by all stakeholders who both receive and deliver healthcare, and ultimately one that could be delivered with the support of all stakeholders. This meant developing a unifying vision around safe, connected and seamless care, and driven by 6 underlying principles to guide effort and investment decisions that deliver the greatest impact. These include patient as an empowered partner, workforce and workplace, digitally enabled and connected care, data-driven services, a digital health ecosystem and innovation, and lastly, secure foundations and digital enablers. These principles are to guide the transformation of Ireland's health system, ensuring a focus on patient empowerment, workforce development, connected care, data-driven decisions, innovation and robust digital security. Really, it was about recognising the need for both the Department, the HSE and the wider system to be aligned behind one vision, and as you say, Joyce, to allow everybody to speak with one voice in digital health. And that really is about delivering safe, seamless and connected care for everyone who needs it.
Derek, you've spoken before about the importance of digital infrastructure and standards. How are these foundational elements enabling the system to deliver more joined-up care?
I think you're right, Joyce. Data, standards and national infrastructure are really foundational elements that enable our health system to deliver more joined-up care by ensuring secure, reliable and seamless sharing of health information across providers and borders. Data forms a core resource. We're a service that's data-rich, and we should use this data to provide a comprehensive and accurate picture of a patient's health journey when securely shared between care settings. And that's both for the benefit of the patient and their care providers. This allows for better coordination, reduces duplication and supports timely informed clinical decision. Data also allows for research and innovation, and this really is aligned with Europe's ambition to develop a European health data space. When I look at standards are really about ensuring interoperability, and that really means different health systems and health services and devices can communicate and exchange information efficiently. So common standards, such as those again promoted by Europe through the European health data space, allow for consistent data formats, protocols, so that patient records are accessible and usable wherever care is delivered. National infrastructure provides the secure, scalable platforms and governance needed to manage, protect and share our health data at scale. Taking all of these together, both standards, data and national infrastructure, these elements create a robust interoperable ecosystem that ultimately is about empowering patients, supporting healthcare professionals and drives innovation while protecting privacy and data security.
Derek, what are you most excited about now as we move into the next phase of Ireland's digital health journey?
What excites me most is the potential for truly integrated patient-centred care that's clinically led, service-driven and enabled by digital. The rollout of the Health app and shared care records are foundational to enable coordinated and connected care for the first time in Ireland. In time, a national electronic health record will empower patients, streamline workflows for clinicians and make healthcare more accessible and equitable across Ireland. These advances look to transform how care is delivered, making it safer, more efficient and more responsive to the needs of every person in Ireland.
And finally, Derek, if you could share one message maybe with colleagues across the system working on digital transformation, what would that be?
So Joyce, my message is very simple. Let's all continue to work together, united by our shared vision to digitally enable our health service, to deliver seamless, safe and connected care for everyone, because our collaboration and commitment will drive our success and it will make a real difference in people's lives.
Derek, thank you so much for sharing your time and insights today. It's very clear that digital for care and Ireland's role in the European landscape is about building a system that's people-focused, connected and future-ready. We really appreciate your leadership in this and look forward to what comes next.
Thanks very much, Joyce.